We all love our families, but some families end up fighting during stressful situations. Discussing advanced directives is a difficult yet crucial conversation that can save your family during a crisis. Think of it as a gift to your loved ones. Advanced directives are legal documents that allow you to spell out ahead of time what types of medical care you would want if you ever became unable to speak for yourself. These documents can help ensure that you will get the care that you want even if you have an unexpected serious illness or accident. The documents can also make things easier for the people who will need to make decisions for you if you ever become unable to make them for yourself. Are there different kinds of advanced directives? Yes, the most useful kinds of advanced directives are Healthcare Proxy, also called the Durable Power of Attorney for Healthcare, Living Will, and Do Not Resuscitate or Do Not Intubate Order, also called DNR or DNI. The Healthcare Proxy document allows you to choose someone to make medical decisions for you if you become unable to speak for yourself. The benefit of having this document is that it makes your choice of decision maker clear to your doctors and family members. When you choose a healthcare proxy, it is important to talk to the person you choose about the things that you do or don't want. That way, your decision maker knows what to do later on if he or she ever has to speak for you. Choose someone who you trust, who can separate his or her own wishes from your own. Choose someone who would carry out your wishes and advocate for you if that became necessary. Choose someone who would easily be reached and who could handle it if other family members or loved ones wanted you to get treated differently than what you would want. It is also important to choose a second person as an alternate proxy in case your first person cannot be reached at the time decisions need to be made. Living Will is the document that tells healthcare providers what type of care you want if you become unable to speak for yourself. If you decide you do not want your heart restarted if it stops, and you do not want a breathing tube put in if you stop breathing, you can ask for a DNR or DNI. This is a form that must be signed by a doctor. The physician order for life-sustaining treatment, also called POLST form, spells out exactly what care should be given and not given, based on your choices and wishes. It is signed by your doctor, and I recommend that you give a copy to your family and your healthcare proxy as well. Advanced directives are a good idea for anyone, but they are especially important if you're older than 65, you have a serious life-threatening illness such as an advanced cancer or end-stage heart or liver failure. Advanced directives are especially important if the person you choose as healthcare proxy is not a family member or legally married to you. If that is the case, the person you would choose might not be allowed to make decisions for you. Unless there is a healthcare proxy, the law usually states that the person's closest family member has the right to make decisions for him or her. What kinds of decisions will I need to make? Many people who have advanced directives record their wishes about the following statements: breathing tubes, cardiopulmonary resuscitation or CPR, feeding tubes and IV fluids. If you stop breathing or are having a hard time breathing, you can get attached to a machine that'll help you breathe. For that to happen, you will have to be intubated. That means that a tube will be put down your throat and into your lungs. The tube will then be connected to a breathing machine. Sometimes the breathing machine is needed only for a short time, such as during lung infection or asthma. When deciding about breathing tubes, consider whether you would want it at all, want it for only a few days, or want it no matter what. Regarding CPR, if your heart stops beating suddenly, doctors might be able to restart it by pumping on your chest, putting in a breathing tube to push air into your lungs, giving you an electric shock called defibrillation, and giving you special medicines. Some people recover completely after having their heart restarted. Others have permanent brain damage from lack of blood flow to the brain. This is most likely in people who have an advanced serious illness. Can I change my mind? Yes, you can change your mind at any time. If you sign an advanced directive and you decide you want a different kind of treatment, or you no longer want the healthcare proxy you chose, all you have to do is tell your doctor or nurse about your new decision. You can draw up new documents if you want to change anything. It is important to note that a living will only kick in if you are unable to make decisions, such as when you're unconscious or if you're incapacitated. Cognitive impairment does not equate to impaired decision-making capacity. It is essential that the capacity be reassessed by your physician prior to any major decisions if in doubt. Medical power of attorney is valid only when a patient does not have capacity. It is important to discuss your advanced directives with your family before a major life event happens. Thank you for listening. If you like this video, please click the like button, hit subscribe, and ring the bell. Be healthier.